going to see about the case study. So a patient with 37 years old was admitted to a hospital in the complaint of COVID-19 pneumonia. So once the COVID-19 pneumonia has been resolved, the patient is having an ARDS, acute respiratory distress syndrome. Once he gets an acute respiratory distress syndrome, automatically his oxygen level has been dropped. So he makes to a hypoxia and hypercapnia. So in spite of giving more amount of oxygen to the ventilatory support, he cannot be able to cope up with the oxygen support. So automatically the patient was enrolled for a VV ECMO, where the patient has been given that support for almost 14 days on ECMO. After 14 days of ECMO and the recovery phase, the patient was discharged at the 47 days with the proper clear lung after the VV ECMO. So what is this VV ECMO is about, and how this VV ECMO have corrected the pneumonia and the COVID-19? We'll see how it is working through the students' demo. Thank you.
Hi everyone, I am Mitra. So today I am going to explain about what is ECMO and what are the types of ECMO. So ECMO is extracorporeal membrane oxygenation, and it is of three types: venovenous ECMO, which is totally used for lung support, and arterial ECMO, which is used for both lung and heart, and hybrid ECMO. So ECMO, it is a closed circuit which is mostly used for the potentially reversible disease patients, and it is considered as only a life supportive therapy and not a treatment.
I am here to explain the indications for VV ECMO. The first one is pediatric. Pediatric having cardiac arrest, failed from being CPB and pulmonary myocardis. The second one is adult. Adult having MI, pulmonary embolism, smoke inhalation, pneumonia, ARDS, and viral infection like COVID. And the last one is procedure support. Procedure support having first one is lung transplant, second one is abdominal aneurysm case, third one is angioplasty. Thank you.
Today see about main components of VV. Femoral vein, axis cannula, flow meter, centrifugal pump, oxygenator, gas burner, antigen cylinder, integrated heat exchanger, arterial filter, return cannula, saturation device, aquathum, dial cable, monitor, alarm, free membrane pressure, post membrane pressure.
I am going to explain about the VV ECMO's workflow. The VV ECMO is venovenous ECMO. The venovenous ECMO consists of femoral vein and jugular vein. From the femoral vein, the axis cannula is planted. From the blood flows through the axis cannula to the centrifugal pump, where the centrifugal pump is attached to the flow meter. Together it makes a console. The console is attached to the monitor via train cable. The centrifugal pumps pass out the blood to the oxygenator. The oxygenator is integrated part where it is connected to the machine. The oxygenator consists of integrated heat exchanger and an arterial filter. The oxygenator outlet lines are connected to aquathum, gas bladder, and oxygen cylinder. The blood from the oxygenator to the return cannula, the oxygenation takes place inside the oxygenator. The aquathum controls the temperature of the blood, and the gas bladder controls the amount of oxygen we needed for the patient. From the return cannula, the blood flows through the jugular vein. Between the return cannula and the jugular vein, there is a device connected which is for maintaining the saturation. The saturation levels are checked in arterial outlet and the ranges. For the flow of VV ECMO, the formula for flow is body surface area into cardiac index. Based on the body surface area and the cardiac index, the flow is calculated. And the second thing is central venous pressure. The central venous pressure should be between 8 to 12 mmHg. And next is transmembrane pressure. Transmembrane pressure is a result of pre-membrane pressure and the post-membrane pressure, which is attached to the oxygenator. The difference should be 50 mmHg. And after the transmembrane pressure, the ACT should be calculated for each and every one. The ACT should be more than 300 seconds.
See about preparation steps, verify the case and patient selection, check expiry date, prepare the surface for assembly, prepare hand hygiene technique, open components for assembly in sterile manner, mount pump head to console.
I am Sanjarajan and tell about preparation steps for ECMO. Venous drainage tube connect and to connect return drainage tube and to connect water lines and to connect gas lines to oxygenator. Ensure the pump monitor.